many of us are taking care of our elderly family members that we become the patient ourselves. So we have Dr. Susan Stone here, who helps with comprehensive care programs, to talk to us about the family that is taking care of elderly patients. What are some of the things that you do with working with families?
This is an epidemic. We have the baby boomers rolling in, and the elderly population is escalating at a rapid pace, leaving us all caring for this population, large amount of dementia. It's very difficult care. It's heartbreaking.
Because you find yourself in it.
You find yourself in it, yes.
Right when it happens, in that urgent situation, you're so emotional, and you have to make these decisions, and you don't know what's out there.
And it's a change of who that person was. This is a person who took care of you, and now you're taking care of them, and it's not an easy ride. So there's many things we can do to help families and patients. First of all, there are house call programs, which is what we do. We go to the home, wherever they are, for our homebound seniors with dementia, and we do all their physical exam, we draw their labs, we do all that we can medically at the home, which is where they want to be.
You know, Dr. Stone, but with that, I'm in the throes of this right now. My mom is just recently diagnosed, and it's really, really difficult. And I think the thing that was so disheartening to me is I felt like I was not prepared. It happened overnight. And as Sunita said, I really feel that I'm the patient. So for the people in my generation who one day is A and the next day you don't know your parent, what can you do to help us with those stressful moments? What could I have done to be prepared? Because I'm so not prepared, and I'm really stressed, and it's really difficult.
I think that this is, I wouldn't say there isn't a person who isn't feeling the same way you are in your unique situations. The first thing you can do, or to prepare for this stage of your loved one's end of life, and for all of us, is to complete an advance directive so that we know what they want as they get older.
And even before that, would you recommend long-term care insurance? I mean, what you do, is that covered under your medical insurance, some of these options?
We do it as part of our medical group because we see that to provide that level of care at the home for these patients, it's kinder. So it makes more sense. We're keeping them out of the aggressive environment of the medical
and
centers.
that's so important. But at our age, midlife, when we should be thinking long-term about this, should we go to our medical plan and get some of these questions answered so we are a little bit more prepared in the future, and so that our children aren't in the same situation?
And then how do I still represent my mom's needs, or the mother's needs? Because every day she's saying, what's happening to me? What do I say? How could I have been initially prepared? Or how do I respond to that? Because all of us are transitioning.
I don't think that you can emotionally prepare someone for the advancing phase of dementia. I think it's too difficult. You're losing your faculties, and it's frustrating. We can all imagine if we were losing our memory, and every day it was one less thing that you can do. So patience, and I'm going to say something that's very important for all caregivers. Every person who's a caregiver is at high risk of cardiac disease.
Oh my gosh. So are there support groups?
Yeah, for post-traumatic stress disorder. And we know from studies that it takes a toll on you, not only physically, but emotionally. So there's a large amount of data about this. So what we recommend for caregivers are, number one, you must find time during the day, during the week, for yourself to get away from the caregiving situation and take care of yourself. The other issue is you're going to have to look into getting help at home. You can't do it all. And you don't have the expertise that some of the caregivers and our agency has to go in and do things like bathe, hand feed, diapers, all of those issues.
Does your agency have a social worker or a case manager
to
help somebody put it all together?
You just hit the nail on the head. We are no longer in that mindset in medicine today that one doctor can do it. That's not realistic. So the teams now are working in a multidisciplinary effort, such as our services have a physician, nurse practitioners, case managers, a social worker, or psychologist. Spiritual support is key.
Oh, absolutely.
Reaching out to your spiritual community for help as well.
And
knowing that you are there because you love this person, and they know that you love them, but you have to take care of yourself in there too.
And I think what's so disheartening for the people in my generation who are doing that is because we are trying to do so much and be everything to everyone that we're forgetting about ourselves. And I tell you, I feel like, and I know the other people out there, I feel like I'm going to explode. And so that's why I'm asking you, what do I do? Because she needs me. She
well, you
needs
look out
me.
to us. You know, we are here for you, Stacy, and you know you need to be there for your mom, and then you need to look to us to support you.
And your
and
mom
maybe
would
take
want that.
breaks.
Your mom would want you to take care of yourself.
And we have support groups. I invite you to our support group.
Okay, so that's something that our viewers can look in their community and look for support
Absolutely.
groups and friends and,
Yes.
and really realize
Reach
that there
out.
is reach
Yeah.
out.
You have to.
Well, thank you, Dr. Stone. Obviously, this is such an emotional issue for so many families out there, and we
Absolutely.
thank you for coming on and talking about this.
Thank you.
And thank you,
so
Stacy,
much
too.
for
Thank you,
coming.
Stacy.
I appreciate
And
that.
we'll be back with more Every Way Woman.
And you just got sick overnight.